Okay, we're going to go over chapter 19. In your textbook, this is physical activity and exercise. And as you guys are already aware, when we're dealing with physical activity and aging, a regular physical activity is really essential for healthy aging. And I will tell you, the patients that I go to see, the ones that are the healthiest and the most independent, are the ones that exercise on a regular basis. Exercise increases functional status, increases health, decreases the number of chronic illnesses. It also helps with depression. And if you look on box 19.1, there's some health benefits of physical activity. It does help to reduce falls. It improves bone health and functional health, and it also decreases the risk for a lot of chronic conditions like high blood pressure, diabetes. So, just a lot of benefits to physical activity. Having said that, only about 16% of older adults exercise on a regular basis. Physical inactivity is a leading cause, a leading risk factor for mortality. So it causes things like hypertension, high blood glucose level, physical activity, and obesity. Even a small amount of physical activity can be helpful, and this recommends 30 minutes of moderate activity several days a week. But what I tell people is just, that's a goal to shoot for, but also try to just add in little lifestyle things. So maybe you park further away from the store and you have to walk. Maybe you do 10 minutes a day and you split that up. Just something to increase movement. For assessment, so as nurses, we want to assess the function and mobility of the older adult. You can provide exercise counseling as part of the assessment, and then patients that are really frail, they may need a more comprehensive assessment to make sure that they can exercise without causing more damage or more harm. They may even need to see a physician to say, okay, yes, I'm cleared to exercise or I'm cleared to do these activities, just to make sure that we don't do more harm. The CDC has a program called Growing Stronger, and I'll try to show you the link to that, but there's some good activities and good tips on that. Older adults are less likely to receive exercise counseling from their primary care providers than younger individuals. And so as nurses, we can kind of help set up some of these programs and help, especially in the long-term care community, with exercise. So the big guidelines that you need to know, and this is true for younger adults, older adults, these are the basic guidelines, but the recommendation is 150 minutes of moderate intensity aerobic activity per week. So that, if you're going to split that up, that counts for 30 minutes of exercise 5 days a week, or you can split it up into different times. And then this is the part I feel like we often forget. And there's muscle strengthening activities on 2 or more days. So lifting weights or doing something to strengthen muscles. So it's the combination of aerobic and anaerobic, or like muscle strengthening exercises. Some best practice exercise tips. We already talked about, you want to screen them before exercising. Make sure it's safe for them to exercise. Find out what some of their barriers are and how they can overcome those. Refer to community resources. Try to make the program fun. If it's fun, they're a lot more likely to stick with it. Make sure you give them safety tips of, when to stop exercising. Like, you may say, if you have any chest pain at all, you need to stop exercising, or if you get short of breath, or whatever those parameters are, but making sure they understand that. Having them do a warm up and a cool down to prevent injury, and then just telling them that it doesn't have to just be structured exercise. There can be just lifestyle activities that they enjoy doing, like gardening or raking. These can all be parts of physical activity too. So we already talked a little bit, but about you can try to incorporate physical activity into the lifestyle. You don't have to buy a lot of fancy equipment for it. There are benefits of group exercise. This can help with social and emotional health and can just be more enjoyable for exercising. Muscle strengthening exercises. This provides joint stability. And a really great activity that I love and for the older population is swimming because it decreases the resistance and the pressure on the joints. And so and it a lot of people that have like painful joints that it hurts to walk or hurts to move, they can get into the swimming pool and do really well just with that lack of stress on their joints. Some special considerations, even exercise for the frail adult, for someone who's very frail, it's beneficial and recommended at least 2 to 3 times a week. So this is even in our nursing home residents. We recommend that they have physical activity 2 to 3 times a week. One of my favorite things that I've seen the activities director do in the nursing home is they'll get the big exercise ball and they'll give everyone drumsticks, and they residents kind of hit the ball with the drumsticks, and that can get them moving with their arms, or tossing a balloon or a ball to someone else, and this helps with movement. Older adults that have cognitive impairment who exercise can actually improve cognitive function and improve their ability to perform activities of daily living. It's a little bit, so we've talked about outpatient settings. It's a little bit tricky when we're talking about inpatient or acute care settings, but there is a growing need to focus on hospitalized older adults. You lose so much body mass and energy by just laying in the hospital bed. So there's a significant loss of total lean and fat mass and strength in older people. And I was just going to tell you, I have heard it said before that for every day a person is in the hospital, it takes a week to recover, because you're sitting there, you're completely inactive. A lot of times you're not supposed to even get up, and your body really starts to lose some function. You want to do a baseline assessment when someone first comes into the hospital so you know what their functional ability is, and then you can make goals for while they're in the hospital of how movement goals and how you want them to move. The plan of care should include interventions on how to improve function for the adult in the hospital. There's something called function focused care, FFC, used to be known as restorative care, and this is a system level approach. It prioritizes preserving and restoring functional capacity, and it's a philosophy of care where nurses acknowledge older adults' physical activities and cognitive capabilities with regard to function, and integrate functional and physical activities into all care interactions. So making sure every time that they interact with the resident that they're trying to include this physical activity. So examples of function-focused care, so this is basically function-focused care is basically don't do for the patient what they can do for themselves. So do they need to be moved up in bed? Can they help at all with their feet? Can they scoot themselves up? If so, have them do that. When they've got to go to an activity, instead of wheeling them in their wheelchair, even though it may seem helpful, let them wheel themselves, because that is helpful for exercise and also just feeling independent. So basically allow them to do the things that they can do for themselves instead of just you doing it. It's hard to do because it's so much faster for you just to do it. It's hard to set back, but it really is important. How much time should be devoted to moderate activity in order to improve health? And the answer is 30 minutes daily, 5 times a week. And in order to effectively incorporate physical activity into lifestyle, a person, A, doesn't need expensive gym equipment, B, incorporates muscle strengthening exercises without weight bearing, C, considers group exercise for its social and emotional health benefits, or D, all of the above? And the answer is D, all of the above. This concludes our lecture on chapter 19.